People come into the Cardiovascular Genetics clinic for a number of different reasons. Some come because they have a family history of congenital heart disease and they're wondering if they themselves are at risk or if their future children might be at risk. Other people come in because their child has a specific diagnosis and they have questions about that, or they have genetic testing results that they'd like to know more about or have questions about those genetic testing results.
We receive both patient and physician referrals. If you're a patient, the first step is to reach out to your local care team, whether that be your primary care provider or your local cardiologist, and request for them to send a referral to us. This is important because the referral will detail the clinical need for the appointment to ensure that this visit is medically necessary. Your physician can fax or email this referral to us, and then you can feel free to give us a call to schedule your appointment.
For our new patients in the Center for Cardiovascular Genetics, we want to make sure that the first visit is as informative and productive for the patient as it can be. Ahead of your first visit, new patients should expect the team to be working to gather as much information as possible. This includes clinical records from a cardiologist, a pediatrician, or other specialists. The team may also ask to gather family health records that may be relevant. Finally, our team will ask for any genetic testing that may have already been completed in your family. All of this information helps to inform our care plan for the patient and helps us to be as prepared for the visit as possible. At your first visit, you can expect to meet with one of our team's clinicians, where we ask questions about the patient's medical history, developmental history, as well as the family history. Your visit may include meeting with a genetic counselor as well. After a detailed conversation and assessment of the patient, our team will collaborate to make a specific care plan that is tailored to the patient. Our team will make recommendations for the next steps, which may include genetic testing, surveillance, cardiac evaluations, other diagnostic testing, or evaluations of first-degree relatives. A significant portion of your visit is always dedicated to education and answering questions so that you, the patient, and family feel educated and supported on this journey. Most importantly, you should expect to be an active member of your own care team. Our team prioritizes family and patient-centered care, and our goal is to create treatment plans and decisions that empower and inform the patient and family.
A geneticist is a physician, someone who's generally trained first in either pediatrics or internal medicine, who then does a second residency in genetics, and we focus on how genetic changes can cause medical and neurodevelopmental complications, understanding how those genetic changes can manifest in families and be passed down, and how to best take care of children who have genetic diagnoses. What you can expect from an evaluation from a geneticist is not that different from a regular medical evaluation. We review medical histories, but we also talk about developmental histories, family medical histories, and the examination is similar to a general physical examination, but also includes measurements and other inspections, nothing that hurts, that's more specific to making a genetic diagnosis.
At your visit, you might meet different members of our multidisciplinary team, including doctors, nurse practitioners, genetic counselors, our team's psychologist, social work, child life, echo technicians, exercise physiologists, and clinical assistants. We can even see different family members on the same visit. This actually helps us understand your health conditions overall.